I like the House Targaryen shirt.
Yeah, that's all I wear is just Game of Thrones shirts or like stuff I got for free when I went to courses.
Oh, perfect. Awesome.
Life.
Hmm.
How's life?
It's good. I don't know. I start up in 3 weeks, so I'm bearing down to get ready here. I didn't. I made the mistake of not checking my email for school too often. So then I realized I was way behind on getting clearances and all that. So now I'm playing catch up. But I think I'll be good. I've got most of it done. So yeah.
Good luck with that.
Yeah.
It'll be interesting to get into school, and then hopefully we stay in touch and we could evolve some of the questions based on what you're learning in school. Because I'm 15 years out of school, 14, 15 years out of school. I'm curious always to see what is being taught now compared to when I was in school. I was also an adjunct professor for a year, and it was different than when I went to school, but it was still very different than what is taught clinically or when you go to continuing education courses. So I think that'll be valuable for you and also for me if we
definitely
contact, just to get a sense of where are some of the differences and can we find commonalities in things that seem very different.
Yeah, definitely. That'll be good. I mean,
cardio today.
Yeah. So first one is just basically, I feel like a lot of times just people tend to have a higher than normal resting heart rate. It's like higher than what's considered good or healthy. So I guess my question is for that, just how, for people that come in with that, if that's something you measure, then how do you like to program aerobic training for those clients?
So maybe I should measure that more right off the bat for everybody. I usually wait and allow certain measurements to take hold as I'm working with people longer. I'm becoming a bigger and bigger proponent of using a heart rate monitor, and I've been assessing different ones just to see which ones are more accurate, but which are also more practical for people. And what I'm finding with my own personal training and then also for clients is that it's really important to have a monitoring process that is ongoing. So if you get someone started in the clinic or in the training world with just teaching people how to use heart rate monitors, that could be so valuable because you're not going to get a lot of information always with one reading, but a lot of wearables now will give you your idea of what your resting heart rate is. And that's really valuable. And some people don't even look at it, but if you just bring their attention to it, it's like, oh, you got an iWatch, you got an Apple Watch. Just check what your resting heart rate is. It's in there. You just might not look at it. So it gives people that awareness of where they're starting. I actually find that a lot of people that are older in my clientele, like they actually have pretty good resting heart rates. It's just that they don't know from an exercise standpoint what they're shooting for when it comes to cardio, when it comes to aerobic exercise. Like the idea of actually doing cardio, they don't have a good definition for it. So it'll be just like I'm on an elliptical or I'm on a bike or I'm on a rower and I'm just moving and I'm sweating, right? Where I think cardiovascular exercise has to be looking at heart rate and having some type of intention around that heart rate. So there's the zones that you can look at where it would be 75 to 85% of max heart rate. Maybe that's a cardiovascular zone, but it's important to actually be paying attention to that when you're doing it, or I don't think you can say you're doing cardio, right? So if you're just on a machine and you're not really don't have an intention around your heart rate, then you're moving, and that can be valuable. That's aerobic exercise, but it's not necessarily cardiovascular exercise. And I think that's where you can make the distinction there. So first thing to do is just give people like a starting point. All right, what is your resting heart rate? Is it okay? If it's not, most likely it's not going to matter that much unless it's unsafe. If it's unsafe, then you might have to refer them out. I haven't had many issues where that's the case, but it's then just a matter of saying like aerobic exercise is important to you. What does that mean to you? And are you actually monitoring your heart rate ever when you're exercising? So it's starting that conversation. And I've been trying to do more and more of that, using just a polar app like the chest strap, but also the Morpheus app through Joel Jamieson. That's been helpful. Just it ties in heart rate variability. It gives the specific zones that are for conditioning, and they've actually changed the lingo. It used to be conditioning zone, now it's the cardio zone. So it's just this kind of green zone. It's very similar to the idea of what Orange Theory is built on. It's just finding your zone. And that's a valuable thing to just have people understand what gets them into a cardio zone. The thing is you don't often need a lot. You don't need as much as you think, and that's what I think is valuable to show clients. Or it's like if you're monitoring this, you actually don't have to work as hard as you think. You don't have to deplete yourself. You just have to find the things that do this, and you can vary the activity you're doing. So if you find 4 or 5 activities that can get your heart rate up, it makes it even easier to get yourself doing cardio, because all you got to do is just keep your heart rate in that zone for an allotted amount of time. And then it's about building that time, maybe 20 minutes, maybe 30 minutes. It really depends on the person and what their starting point is. But I think it's important to get people using technology, because it's there, it's all around them, and just seeing how like that could be valuable.
Mm-hmm. Yeah. What, like, for, like, I guess, like, as long as your heart rate's in that zone, like your target zone, whatever that is, I guess it really doesn't matter what you're doing. So do you ever go and, like, I guess at MSI sometimes or a lot of times we'll do is program like a long, just like low level circuit that's just with the idea of getting their heart rate in that zone, and then mixing in some, maybe like some sort of strength, like some tempo split squats or stuff like that, or some reset stuff that's like supposed to help getting people move better. What are your thoughts on doing that in addition to
I love the idea, and I think without the monitoring of heart rate, hold on one second, come here, my son is asking a question. What do you want? You're not buying anything. Okay. You need my face. He needs my face. You good? Okay. No, I love the idea with that, but without understanding the idea of the heart rate zone, you know, the definition of cardio is something different. And that's one of the things I've actually started to do with my clients. And my clientele, they're not athletes, they're older. And the facility I have like 3 cardio machines. I got a skier, I got a rower, and I got the assault bike. So I'll have people go through those, but then it's about finding other things that often easily get people in that zone. And one of the things I found is you need a combination of intensity and duration, which is a very specific combo for a lot of things. So cardio machines tend to work really well for that, but not all of them for all people. And it depends on how long you've been going for how long or how well that machine is going to work to keep you into that zone. So, for example, a ski rig I find is hard to start with to get people into a cardio zone, because muscle fatigue will take over, especially in the arm, especially if they're not really well attuned to the use of the ski rig. But something like a rower or any type of attempt at jogging gets people there much quicker. And then the other thing that I find valuable is step ups that aren't fast, but give you some type of challenge, whether you're loading it or for somebody who's just not used to a higher step up, just doing that continuously with some type of rhythm that is sustainable, very valuable. And it doesn't feel like you're depleting yourself. It just feels like you're going a little bit harder than like a normal step would be, but you're doing it for a long enough period of time. And then you're just curious about what your heart rate's going to do. So I've been experimenting with that with myself, but with a lot of my clients, because what gets my heart rate to a certain place isn't going to be the same for other people, or they might not be able to hit the same intensity with the same amount of ease to do it as long. And vice versa. Like I find that I have clients that can do things way better than I can in certain realms. And it's just like, okay, it is what it is. So it's a matter of just figuring out like, what keeps you in that zone. So if that's your guiding principle, then you have a lot of variability and versatility of how to do that. And I think that's really valuable.
What would like with the step ups, would that fit into like what people tend to call like high intensity continuous training?
Yeah, I think so. I mean, I haven't looked too much into that specific diagnosis, but sorry, definition, but that makes sense to me.
Yeah.
I don't. I think the idea of high intensity is debatable there. So I mean, that's its own definition issue, where the goal is not to be high intensity; it's to be high enough intensity to get you there. And I think that is the lesson that is often needs to be learned, is that you don't have to work as hard as you think to do cardio. It also doesn't have to be as monotonous as you think.
Yeah.
So my lower, my like more steady state days will tend to be still interval based. I lost you for a second there.
My back. There we go.
Yeah.
Sorry.
No problem. But so like longer steady state days still have a little interval potential there if you're using your heart rate monitor, right? So you don't have to be on the same machine or be doing the same activity for it to be steady state. You just don't have to be trying to hit real high intensities. You're just going until you get to a point where your intensity or your heart rate is at a certain level. And then if it goes beyond that, you slow it down.
Yep.
Just try to maintain that. And then you can also mix up machines. So just the variability makes things much more tolerable and much easier, much less stressful on the joints, because there's not going to be as much overuse of the same pattern. And, I think you have to look at what's the intention of your cardio. Is it to get better at rowing? Is it to get better at running? You know what I mean? Like the things that we think of as cardiovascular movements, is it performance with them, or is it just to get your heart rate in a certain zone for a certain amount of time? And from a health perspective, most of the time it's just the latter, just to stay with get your heart rate in a certain zone. And from a physical therapist perspective, I think there's, it's like killing two birds with one stone. You're getting that cardio element, which people need, and that's catch-all for so many things, but it also prevents the overuse that we have to kind of work people away from. And if you're an athlete, like, why are you trying to be a better runner when you're not a runner? You know what I mean? Yeah. Why are you trying to be a better rower? I mean, know about the efficiency of the movement, but don't train to get like a great 5K. Don't train to get a great 10K. You know what I mean? Get your conditioning zones where they need to be. And that becomes a category of something that you're training. And ultimately the test of is it helpful will be on the playing field, will be on the practice field. Like, do you feel like the very specific things that you're doing in your sport are getting easier? And I think you'll find that they will be if there's a consistency in just getting your heart rate in those zones and figuring out the many ways you can do that instead of just having, one or two options for doing it.
Yeah. It's interesting because like a lot of like the pro guys that come in, like they just say they basically get turned into runners when they go to spring training, because it's like they just run back and forth the whole time, and that's like the only source of any aerobic training they do. But it's funny because it's like, I think running, you spoke to it earlier, more than anything, like just jacks your heart rate up pretty quick. Yeah. And I tend to find if I try to get in that sort of sweet spot zone of, I don't know, maybe heart rate like 120 to 140 or something, or even a little lower, it's like I almost have to walk at some points because it just goes way up.
That's been my major mode of cardio a lot lately, especially when I like to get outside, is I just put a heart rate monitor on and I have a certain zone I want to hit, and I'm walking all the time, but it's enjoyable. Like, because when I'm running, I am doing running intervals just to the point where I get myself to where I want to be. But if I keep going, I know I'm going to go beyond it. Yeah. So I'm working on my technique a lot within those short bouts, and I'm just doing that frequently. But then I'm walking and just allowing the heart rate to come down. And in that time, it just gets so much more enjoyable when you're outside to just walk around, take things in. Like, you're not gassed. You're not always working on a certain pace that you have to maintain.
Hmm.
So there's more of a feeling of what's the quality of your movement, and then also just like what's exercise supposed to be about from a health perspective. It's supposed to make you feel good in many ways, and especially cardiovascular exercise. Like there's so much evidence on cardiovascular exercise for helping mental health issues, and I think there can be a, a way of overusing the stress response, like that feeling of just taking yourself to the max and getting some type of dopamine kick out of that to try to work your problems out by just suffering. And that's a very different feeling than just maintaining movement, right? And getting your heart rate to a certain place and keeping it there. There's different physiology involved in that. And it's a very different feeling. So when you're an athlete, a lot of times you're taught to work harder, right? And I know that's the household I grew up in, and I wouldn't say it's because my dad wasn't necessarily the one who was doing it as a coach. It's just
Yeah.
that that's the world I grew up in. My dad was
Yep.
a coach, and everyone else I was around was an athlete trying to get better. So it was just about, if you're not working hard enough, someone else is working harder, type of
Yeah.
thing. When you separate yourself from that, though, you realize it's not about hard work. It's about intention of work, right? It's
Yep.
intention, and then it ceases to be work. Sometimes it's like, if I don't do this, I'm not going to be as productive today. Um,
Hmm.
so I think that's one of the values I found with just using a heart rate monitor to just see, oh, this is all I got to do. Wow, this is a lot easier than I think. So it becomes a lot more enjoyable, and you still feel like you're getting the value.
Yeah. I remember, like back in college, I thought our strength coach was pretty good, and be like the majority of our aerobic like cardio would just be like low intensity. I guess you got 'em from like Joel Jameson, Charlie Francis stuff, like low intensity intervals on the field. And it
Mm-hmm.
would be hard because it'd be like our like our coach would be like, guys, run harder, and our strength coach would be like, no, like
Yeah.
we're just
Yeah.
relaxing here. Like,
Right.
but it's just so interesting how ingrained that is into sport. Like it's like
Mm-hmm.
someone's always working harder. Yeah, but yeah,
Yeah.
intent is just so important.
Absolutely. Yeah. And we have better technology now that not just in a lab or in a university where they can afford it. If you could just, everybody can have a Fitbit, everybody can have a heart rate monitor, everybody can have a blood pressure monitor that actually is much easier to use. That's one thing I've just recently started utilizing, and I was realizing how much I was underestimating that for my own health and also for my clients, because some of the things that we look at from a fitness standpoint might be very opposite of what's good for blood pressure, or it's
Hmm.
just independent, right? If you look at the research, it's just generally like exercise great for blood pressure and things like that. But if you're already doing that work and you're already watching what you're eating, and you're kind of taking care of yourself, but you're not actually looking at your blood pressure, that's a whole other variable that might need to be manipulated, and it's very important for longevity, right? So it's different than heart rate. It's different than heart rate variability and all of these other things. So I'm just looking at my own heart rate is okay, and it's something I'm looking at on a regular basis, but my blood pressure is often high. And it's just something that if I'm not monitoring it, I'm not thinking about making adjustments for that, right? So there's different ways of using your nutrition that might be geared towards blood pressure. There's different ways to gear your exercise that might be geared towards blood pressure. So it's going to be separate than things that might be geared towards performance. So it's just another thing to monitor. And traditionally, it's this thing where you go to the doctor and they do it for you. And
Yep.
we somehow find that to be somehow useful. It's like going to the doctor and getting weighed once, right? And like, how is that helpful unless you're going to also be then monitoring yourself on a more regular basis while you're making some type of behavioral change? So I think technology is a lot better. It allows us to take the things that we will get like one time a year from our doctor and then be able to monitor ourselves while we're actually making changes so that we can make better decisions.
Hmm.
Right? So I think, I think blood pressure is one of these things that often doesn't get talked about in the recovery realm, because it's not as quick of a thing, but it's certainly going to give you maybe a longer term idea of, do you need to make tweaks to some of your health plans? And then maybe, do you need medication? Like, some people then will just also need a combination of exercise, diet, and medication. But I think it's one thing that can really totally change the way that you think your trajectory of health behaviors goes.
So,
Right?
so then, like, I guess, how do you modify like, say like, if you are someone who has, your diet is fairly well taken care of, like exercise regularly, how do you go about modifying things to target that?
Well, so taking care of would mean that you're just doing it, right? Like, that you're
Yeah.
actually paying attention.
Yep.
But if you have a blood pressure issue, one, it's not my scope of practice necessarily at all
Yeah.
to say, if somebody needs medicine or not. However, it is my scope of practice to have an understanding of, how the body works, and how blood pressure will be affected by exercise, and even to a lesser extent by nutrition. So I think the client, let's take this outside of just having a conversation about, like,
Yeah.
ourselves, but just the client should be seeing their doctor. And if they aren't already seeing their doctor about blood pressure, they should be having that conversation. Most of my clients are, definitely, because they're older, and that's just like a big thing that, physicians are going to be looking at for them. But with that being said, how often are they seeing their physician? Probably not as frequently as blood pressure may change with different things, right? Like, if your diet changes, if your stress changes, if you're inactive for a long period of time, they might not be seeing their physician frequently enough to actually be monitoring those changes appropriately. So we could be part of that. Like, we can start monitoring their blood pressure as well, and just start to say, this is, if you already know about this, your physician already knows about this, maybe you give them a call and just say, like, I'm noticing it's here on a more regular basis. The other piece of it from a nutrition standpoint would be some of the things that, like, high protein intake, like even just a balancing of macronutrients, that might have to be tweaked a little bit. Sodium might have to be tweaked a little bit, which isn't often considered when you're thinking about just balancing macronutrients, right? And if you're eating mostly whole foods, a lot of times it falls into place that your sodium intake will be what's recommended, but not always. And it's just something to pay extra close attention to, still connecting it to some of the other healthy behaviors you might already be doing. So say you're watching your calories and you're trying to balance your macronutrients in maybe a 40-30-30, like a zone parameters, 40% carbs, 30% protein, 30% fat. Well, what you might find is trying to get that 30% protein often connects to a lot of sodium being added into things too. So you have to just make different choices there, or maybe that much protein isn't that important for your goals right now, right? They might be important for your muscle building goals. They might be important for your performance goals, but they might not be very important. It might be at odds with a blood pressure goal. And it's complex, right? Like, the sodium is a bit controversial in how it's looked at from a health perspective. But I think if you're not paying attention to it, and you're paying attention to other things, and you're not even looking at sodium, you're like, I'll look at sugar, I'm looking at everything, but I'm just gonna have as much salty meat as I want, or I'm gonna, like, dairy and bread, just by having that, just has a ton of sodium into it. Then you may have to start to revamp some of your thought processes around that. And to me, it's just about having the data and then saying, okay, what can I tweak here? What does research say? And obviously within nutrition, it can be contradictory sometimes, but you start somewhere, you manipulate a variable, and then you go from there. But if you don't have the original measurement, or you don't even have the thought of the measurement, you won't have the thought of even trying to adjust.
Mm-hmm. Oh, it's interesting. I've never really thought about measuring it, but it's.
I think the other piece is when you look at just not having a versatile enough routine. right?
Yeah.
You can't just go based on what you feel. Like, do I feel good? Do I feel fit? Right? Like, you have to have metrics for things, and health metrics to me trump performance metrics because I'm a healthcare practitioner, right? And they might not if you're a professional athlete, but blood pressure measurements should trump, like, body fat index measurements or something like that. That would be, you're already in a normal range there, but you're just trying to get to more of like I want to see like every ab type of thing, or you're trying to get that couple inches on a vertical jump and stuff like that. So I would look at blood pressure as this thing that would come first.
Yeah.
And if that's the case, then you just have slightly different decisions that you're making. And from a training standpoint, you may want to add a little versatility into your game, because if you're doing only short duration stuff, you're not monitoring, say, a heart rate, you're not getting into a longer duration zone of cardiovascular aerobic exercise, because you're feeling pretty good about your progress with your power and your strength, and you're not really having much care about the other elements that you're missing. Then that's where something like measuring your blood pressure and saying, oh shit, it's a little high, that can kick you into gear to being more versatile. That's one thing that I'm thinking, but I do think it definitely ties into cardiovascular health. And when we talk about cardio.
Absolutely. I guess you touched on this a little bit earlier, but like, is there a way you track aerobic fitness or cardiovascular health for clients? Is it heart rate? Is it just seeing how they handle with, putting them into that heart rate zone and, how they respond to it?
So what I usually do is I'll put people into some type of program. So let's just say I'm seeing somebody 3 times a week, right? I might do one day where I have them just do all aerobic oriented work, and I only have the 3 aerobic machines. So I'll vary that up slightly, but they're oftentimes using the same machines, and I'm going to give them something to focus on, that's an indicator of how easy it is to do that work, right? So, or let's put it this way, like how easy is it for them to go faster? I'm not always going to say like go for your max effort. I might have them work, let's say a 30-30 interval for 5 rounds on a ski erg. And the first time I introduce that to someone, I may not give them much cueing at all. I just might get this baseline of like, how hard was that for you? Right. And then I'll point out maybe later in that session, after they've done a couple bouts, or the next session, all right, look at the speed here, how long it takes you to go 500 meters. See how hard it would be to get yourself to like 230. Depending on what I saw as their baseline, I'll give them some type of goal for performance. And then I want them to link that to like an 8 out of 10 effort in certain cases, maybe a 6 out of 10 effort in other cases. But I'll have them repeat that process until they feel like that it's easier to get there, like that there's less resistance, that they're not working quite as hard to get there. To me, that's an initial sign of progress for that. And then the other piece is it's just the introduction a lot of times for my clients to a different way of looking at cardio, like so that they are doing it consistently, that they are doing it on their own when they're not with me, because I don't think I have enough sessions with people, no matter how many times they come in, unless that's all we're doing is aerobic stuff, to really have a lot of value to seeing progress just by doing like the machines that I have here. But if I can show them how to look at cardio themselves or aerobic exercise themselves, so that they're monitoring things on maybe 3-4 days a week, and then they're actually starting to see how to look at, are they progressing with maybe the same type of exercise session. So if you're doing, let's just say you're doing a mile of running, and you're keeping a similar heart rate, but you just naturally see after you're doing a month of it that it's just, you're going faster, you're taking less breaks, right? Like you just, there's a qualitative piece to it too, or it just feels a lot easier. It's not as hard to actually just get on the machine or go for the run anymore, because it's just more ingrained. Like all of that to me is part of progress, because I don't think you need to look at it from a performance indicator where it's like, I want you to go as fast as possible, because I think that's very different. That's a very different approach. Like, you're not trying to win a race.
Yep.
You're just trying to do the thing that's healthy. So I treat it a lot differently than I would say treat strength training, where it would be over the course of 6 to 8 weeks or something. I want to see, more weight being lifted than it was when we started. And, I have a lot of beginners, so just the introduction to something is brand new, and it's already progress. You know what I mean? Which is cool. It's like, it makes the job a bit easier than it would be if I'm working with high level athletes that have just always been training in various ways for longer and longer. Like, the bigger your training age, the more you have to get creative with how you demonstrate progress. And I think the more specific you want to have people look at things and just say, like, are you making progress or not? I just want someone to have, one, the idea of monitoring heart rate, two, have some metric that you can look at constantly that you can see getting better. Right? And that's it. Some performance, it could be miles per hour, it could be watts, I think is a good one. Just to have somebody, and if they're doing the same workout enough times, that they just see the watts that they're putting out become much easier to put out.
Right. That makes sense. Yeah. Right. So it's almost like you can almost look at it either maybe their pace gets better at a certain heart rate, or I guess their heart rate goes down at the same pace or something. I guess it would end up being the same thing.
Right. But. And I just practically, what I see with like a general pop, if they're not already in a routine of aerobic exercise, it's more of a cognitive behavioral therapy thing. How can you get people to just value it more frequently? And I'm still, exploring that, but one of the things I hope makes it easier is to demonstrate to people that it doesn't have to be as hard as you think. Just but monitor things. And once you monitor them, you realize it just doesn't have to be this, suffrage. It really is just, it will actually make you feel quite a bit better. And you can vary it up, right? Like, you have more than one options. You don't just have to pick like running. You don't have to just pick cycling. You don't have to do a triathlon. You don't have to compete, right? If you want to, then there's a process for that too. Yeah. But it's not cardio. It's a different thing. It's competition then, right? It's sport. It becomes a completely different animal. And then there's the other side of that is the daily movement throughout the course of the day, which isn't necessarily cardio, but depending on how much you're monitoring yourself, like say you're monitoring yourself all day, your heart rate, your the different zones that you get into, your movement, your steps, right? Like all of that is its own category of health and aerobic exercise. Like I think aerobic exercise is a much broader category than cardiovascular exercise. Yep. Aerobic exercise to me, or aerobic activity, because we might not even use the word exercise, which would be more purposeful, would just be to be doing things longer than the creatine phosphagen system and glycolysis. And the intensity would be low enough that you can do it longer. Right? So then there's some type of oxygen usage for energy, right? And then we get into the oxidative aerobic type of work. Well, if you're just getting more steps throughout the course of the day, so you're more active throughout the course of the day, then you are getting more aerobic exercise, in my opinion. That's the way I look at it. And from a practical standpoint and a lifestyle choice standpoint, to look at steps as a way to improve aerobic exercise can be very valuable. It sort of fits into the idea of greasing the groove, where you don't have to just have this bout of exercise that you do at the gym, but you just try to find ways to get more movement throughout the course of the day and accumulate that at the end of the day or the end of a week. And then within that, you have time where your heart rate is in that cardiovascular zone. And then that becomes its own separate thing. But I think the two do work well together, because if you're always stationary and then you ask yourself to have to get your heart rate up more, well, you might be more at risk for injury. It might feel like just more of a stressor for you, and it just becomes a harder thing to sustain in my experience. So I think you want to look at the two as they're part of the same whole, but then cardiovascular exercise has this other component of you actually have to know what your heart rate is, and you want to strive for a certain zone, but oftentimes it's not what people are doing when they're going to a HIIT class and just killing themselves. Like, there's just no control there. There's no intent, right?
Mm-hmm.
Other than just sweating and feeling good, and oftentimes feeling good in a very acute manner, right?
Yeah.
So that becomes to me that seems very like an addictive process.
Mm-hmm.
Very much like having like something that's really hyper palatable. That's what the idea of going to HIIT classes is, just for the sake of sweating, not really for progression, but just saying, like, I want to go there and work my ass off, and I want to get that feeling of working my ass off.
Sorry.
No worries. It's kind of a good feeling to have, but I think it should be used sparingly.
Yeah. What? Yeah. So I guess actually that was going to be my next question is, like, do you ever, and if you do, how often do you like program in a workout where it's like gas pedal down, just like you're going to go after performance, or like HIIT or something like that, where it's like you do get that dopamine effect after?
So I'd say less and less now, and a couple of reasons for that. One, I'm a little more distanced from when I was in my CrossFit coaching days, which was super valuable. But I think if there's one thing I've discarded the most, it was the idea of trying to like compete within your workout, like get as many rounds as you can, go as fast as you can, type of thing. Instead of learn to break out each movement and have a specific purpose within each movement or each set. So and then the second part of that would be when I took the strong endurance course, which was like back in 2017. That was really valuable. So in a nutshell, and that's through Strong First, that's sort of their way of looking at endurance in general, but looking at how to use the kettlebell to promote endurance. And it's in there with stuff that people are already doing, but it put a nice theory to it that makes a lot of sense, and it also keeps you away from that grinding yourself into the ground, but still gives you that piece of actually going for power, going for speed, like going for high intensity, but doing it with a very specific purpose. So the idea is to really skip the glycolysis type feeling, right? That acid building feeling, and really maximize the early stage, which would be like, if you're going to sprint at full bore, you can't do that for very long, right? Let's just say not more than 15 seconds. And that's going to vary, but let's just say, just for argument's sake, like you can't go harder than 15 seconds. You can't go longer than 15 seconds if you're going to really maximize that phosphagen system. And then you need to skip the middle system, which means you have to stop before you get into that acid building place. But then in order to build endurance, you have to do a lot of sets that promote the that aerobic piece. So it's like you're skipping that middle section. Yeah. But it really matters how hard you go in that early section, right? So if you're just doing 15 seconds of like blah, it's not going to be the same thing as if you're really going fast, or you're going powerful, or possibly going heavy. It works better for power and speed within that early stage. Yeah. But you can actually do certain work too, where you just do like one or two really heavy reps that aren't at your max effort, but they make you really have to exert quite a bit of force and give yourself a lot of spaced out rest, so that you can do a lot of sets, and the rest breaks count towards your total time. So if we have this traditional idea of we need to do 30 to 40 minutes or 60 minutes of aerobic exercise. Well, if you do enough sets, then you get to 40 to 60 minutes, but you're counting the rest breaks. And during the rest breaks, it's helpful to walk. It's helpful to shake out the tension. To me, then, if you're wearing like a Fitbit or something, you're also getting steps in that. So that's how you look at it. It's just non-exercise activity sprinkled in with high intensity activity. And that's a combination of aerobic exercise, maybe cardiovascular. If you're monitoring your heart rate, sometimes you get yourself into that heart rate zone naturally just by doing a lot of hard work or fast work. And it doesn't even feel that hard. It just feels like you're going for it, but it stops before it actually gets that hard. And that actually starts to feel good. Like you get this neuro spark from doing that, but you're taking enough breaks that every time you come back for that bout of work, you haven't slowed down. Fatigue isn't setting in to the point where you feel like you can't do another one. So that's in a nutshell, the strong endurance stuff that I've taken, and I really think it's valuable. So valuable for the general population.
It's cool because that's really sort of mirrors and a lot like from what I've read of Charlie Francis. Just with like obviously he works with sprinters, and it's a very different from being with a Gen Pop, but like his idea of you're either going to be in again, I guess his main goal was staying out of that acid building place because it's like his idea was that it's too high intensity to recover from like adequately for whatever the next high intensity bout is, but it's also too low to create like a change in power or speed. So it's cool just because he sort of did that. I guess he set up differently, but like a high-low model where it's like you're going to do your hard sprints on this day with full rest, which sort of mimics. I mean, I'm sure the rest is probably a little longer than using a barbell or kettlebell or something. Right. But then on the low intensity days, it's like tempos or something. But it's just cool to see how it's transferred and used, with different language, but like a similar idea in strong person. It's cool to see how that keeps coming up because I feel like it's that middle zone, that acid building zone that like people just get flattened by.
Right. And now that's your growth zone though. So that could be, if your intention is to build, a hypertrophy, then that's the zone that you go for. And I think that's where a lot of the fitness industry, like they push that as like a health zone. And I'm not anti that zone. Just again, know your intention. Like I like times when I'm in a hypertrophy phase and I'm feeling that, especially with things like squats where it kind of sucks, and then you're walking around sore for a couple of days afterwards. Like there's a value there, but you just don't want that to be all you do.
Right.
And you're not, there's growth there only because you're creating enough stress to promote change, but that growth only happens when you adequately recover, right? So the idea of what's catabolic, what's anabolic, like breaking down is a catabolic process. So when you're training, you're actually breaking stuff down. Anabolic would be when you need enough recovery to allow things to grow. So our recovery is the major factor in how we actually build. But if we want to grow, we do have to go into that glycolysis a lot. But that's not health for a lot of people. Like a lot of people don't need to grow. they don't need to grow more muscle, and they think they do because they have an interesting idea of what fitness is, where it's just like I want to gain more muscle, but I want to lose fat. So they have that as this general idea where if you're coming in and you're already quite overweight, let's just focus on losing fat. Let's try to get your behaviors in place, and you might not be as strong as you think, right? Especially if you haven't had a practice for actually doing a lot of resistance training. Let's work on your weaknesses. You know what I mean? And like we'll see what happens, and then later on maybe we can think about growing some muscle, right? But I think that zone is often thought of as like I need to feel like I'm working hard because that is a psychological sensation of I'm burning calories or something. I'm doing something that is getting me closer to my goal and doing it rapidly, right? There's a part of that zone that is anti-patience, I think, too. And the more that I read, and I'm sure you're seeing the same thing, is that training is about patience. It's about writing down what you want to do for a certain amount of time and just following it. And it's rarely about psyching yourself up. It's rarely about like getting everything you can out of every session. It's just you've already done the work by writing the plan. You just got to like follow it now. And sometimes it's sort of fighting the boredom of that and seeing people PRing on Instagram and not doing a PR day yourself because you want to see where you're at. It's just doing. And the same piece, I think, goes into trying to get faster, trying to, get more powerful, is that you actually have to practice that thing, right? And if you're always at your max, like you're not actually practicing, you're assessing, you're testing. So these multiple bouts that are not, they're close to max, but you have enough rest that you can do a lot of them, that gives you a lot of time to practice. And as soon as you get into that acid producing zone, it's going to be hard for fatigue not to just totally deteriorate your practice.
Yeah. It's cool. Like, I think I had maybe it was Mike Israel or someone had a quote that was just talking about like psyching yourself up for training. And his thought process was kind of sort of sounds similar. He was just like, yeah, like probably 95% of the time you shouldn't have to psych yourself up for training. Like just go in and do your business. And then it's like when it's time to, like if you have planned things out, then you know when you're going to go for something. It's like when it's time to go. But otherwise, like I've gone through that issue too. And I think clients I've worked with have had that issue where it's like they come in and try to get psyched up every day. And it's like, well, then you kind of just like, gas out. And then next thing you know, you're taking like 3 scoops of pre-workout. And like, it's like, it's just exhausting, like mentally and physically. So yeah. But
well, I think that speaks to, what your goals are, especially if you're not an athlete, but some of the ideas behind nutrition and training. And like, my history of fasting and that exploration has been very interesting, because it really made me realize like how little I actually need all of that nutrition around exercise to still keep some point of performance. But when I was in the CrossFit world, or when I was in the like athletic world, I needed it a bit more. And sometimes the two worlds of fitness and sport, they feel like they're the same thing. But going through the process of really eating one meal a day and still training like I normally train has shown me the difference, where it's like if I'm not competing with anything, I don't really need pre-workout. I don't need post-workout. Like these aren't health things. They might make you grow a little bit more. So if you have these very specific hypertrophy goals, which aren't health goals, but they might be performance goals depending on what sport you're in, then that kind of stuff is necessary. But there's such a big industry on it, and I just don't think it's that useful when we're looking at things from a health perspective.
Agreed.
It's just, you shouldn't need to really fuel yourself before or after a workout that much, right? Because then otherwise I think you're working a bit too hard. And I think that's like it's a good metric for how much food do you feel like you need before or after your workout for, are you overworking or not?
Yeah. I think it's a good measure.
Like majority of the time.
I think it's a good measure of recovery in a sense too, because it's like if you're coming in and you're having to, use all these supplements or whatever, it's like, well, are you really ready for that session? Like even mentally, it's like if you feel like you can't just walk in and enjoy going about what you have to do, so we'll maybe reassess other factors.
I mean, and I think there's a counterbalance that people are trying to do with supplementation and pre and post exercise nutrition that is trying to make up for not having other behaviors in place too.
Yeah.
right? So if you look at nutrition, if you got your nutrition down on a broader scale, then you may not have to focus on, trying to have all of these recovery things going on like right after a workout. But again, I think it really depends on the audience. And it's just that the fitness and health audience can often get mixed with the sports performance audience. And they're not the same thing. So when you're a general pop person, or you're someone who's just trying to get into fitness and you want to look at what, Tom Brady's doing, or what, somebody that you really admire in sports are doing, or just the people that are training them, like what are their thought processes? What are they promoting? It may be completely irrelevant to what's helpful for you.
And part of it, I think it carries over to like HIIT classes and stuff, where the group classes and they become competition based instead of, following a personal metric.
Right.
And it's interesting. Like, I don't really know anything about Orange Theory, but it's interesting to I don't know if it's heart rate zones or something, but like if it is, you're staying in a certain zone, like that's a different take on it, which is cool. So.
Right. Yeah. From what I've heard from people that have gone there, it sounds like it's a good premise, but it still falls into the trying to overly motivate people. Right.
Yeah.
And getting people to sort of maybe do things that wouldn't be valuable to get them into that zone. Right. So, what we were talking about is finding a few things that are just easy to get you into that zone without actually having to work so hard. But should we be trying to connect things that are also like building upper body strength and trying to, are we throwing just random stuff like with weights in there that are also trying to make people think that they're building some type of form of strength at the same time that they're getting that cardio zone? And I think that's just the intention probably needs to be more well defined, saying when you're doing this can be valuable, but all you got to do is just keep your heart rate here, right? You don't even have to do all of these different exercises because they just might not be useful. Like if you can find other ones that seem safer for you, seem easier for you to do, that keep your heart rate there. That's just the initial intention, or the initial impression I got from some people that have done it, where they found it valuable, but there are injuries that are promoted just because there's this piece of entertainment that's involved with it too, is that we have to keep coming up with new exercises for people to do that are part of a circuit that gets in there, right? So, in a more controlled environment, you would have better exercises that would, be separated from anything that is thinking about building strength, because that's not what you're doing there. So you would just be working on the things that would be easiest to flow with, to have some combination of intensity and endurance. And then that, I think, keeps things safer too. But that's the only thing I'll say about that is just, because it's a chain, it's going to get caught in the world of trying to entertain. And then that's where it can lose some of its value.
Yeah. I think it's important, like that mixing of intent, I feel like is often pretty common just in the fitness industry in general, but it's just like, I try to think of it as like just having your buckets, and it's like when you want to go after a certain quality, like go after that quality and don't be worrying about trying to train something else at the exact same time, because then neither is going to benefit to the same extent.
Absolutely.
Yeah.
Cool.
Is there a way, like, so we've talked a lot about clients who may need more aerobic training or cardio training in their life. Like, I feel like we've talked about, you've had clients before where it's almost the opposite, where it's like they're just so far down, like to do cardio. Like, how do you determine when someone's, I guess, in a way, like limiting factor is maybe that cardio aerobic piece versus when it's like, okay, this person maybe just like needs to like tune down the knob on the cardio stuff and worry more about training these other qualities, and how that can sort of fit into their overall physical health?
Well, in many ways, it's the same thing we were just talking about, but just with a different focus, where just showing people how to do aerobic or cardiovascular stuff with different movements, because most of the time what you see is not that people are too aerobic necessarily. It's just that they're doing the same aerobic exercises all the time, and they're not incorporating any other attributes into it. So you can vary up their aerobic by somebody who's just doing steady state running, steady state biking, by showing them kettlebell swings and then quickly getting them into some type of strong endurance plan. And if they're not, if kettlebell swings will be too hard for them to learn quickly to be proficient with, then something just like medicine ball work that has that same ability to create power, create that creatine phosphagen action, but just do it for a lot of sets. It gives them still the endurance stuff that they're looking for, but it also adds that power into it. So that would be step one. And then it would be looking at, what are you really coming to see me for? Are you coming to see me to enhance your aerobic stuff? If you're already doing a lot of aerobic stuff, you don't need me to do that. So I'm going to go almost opposite, and I'll show you how to strength train. I'll show you how to power train. So it really depends on what somebody's goals are off the bat. If they want to keep some version of aerobic because that's what they like, then I'll show them a version of the kind of power endurance stuff with optimal rest breaks, and also maybe teach them how to utilize nasal breathing, utilize heart rate monitors, just to make sure that they're not overworking. And that can be really valuable. Showing people how to vary things up, that are endurance athletes even, can be really valuable. I have a woman right now that's, she's a bit older, but she's still kicking butt with doing triathletes and things like that. And she's very easy to work with because she's very open to learning new things. But oftentimes it's breaking down what she's doing. Like, she's always in a plan, and she knows that. And I don't want to change that because she's already been successful with it. But it's just giving her some other things to focus on. Maybe it's drills for running. It's maybe how to feel her body slightly differently. Breaking up the idea of cycling and running as, okay, this is a rotational movement that you have to do for a long period of time. So having her understand something like a hip shift and giving that quality to what she's already doing can be very valuable. But then it can be, okay, what else are you doing? Are you doing strength training? If she is, let me look at that program and see if I can add some to it, which you usually can. Right? But I think it's sort of like meeting people where they are. But I don't think that's always a difficult thing to do. It's just if you want to keep it more on the endurance side and you want to vary it up, then you add more of the strong endurance type of work, or whatever you want to think of that as. It could be high intensity interval. I don't think is a good way to put it anymore, because that just promotes more of that idea of just like working really hard and taking yourself to the limit. But getting people to feel what power and speed feels like, and then giving them enough rest that they can repeat that over and over again. And then also getting people to feel like what actual like strength training feels like, what starting to get to heavier weights feels like. I think that's often very valuable.
Absolutely. I guess my last question then, just you reminded me of it, was just nasal breathing, how you use it for your clients if you do, and what your thoughts are.
I try to use it for everybody at some point. And if it was a perfect world, I would do it day one for every person. I just don't like to go to things that are really foreign too soon. Right? If I have someone just getting on a bike, I might mention in passing, try to only breathe through your nose, but I'm not going to harp on it. I might start harping on it later. The more I know, I get to know people. But it's hard. It's very difficult for people. So you have to be patient with getting them to have some type of understanding of it. You have to be ready to have the conversation of why, because people aren't going to understand why. It makes a lot of sense for people to open their mouth to breathe, because it feels like they're getting more oxygen and all that, which is a fallacy, but it's hard to break fallacies, right? So I guess it really depends on where I'm at with the person, but the goal would be to have most sessions nasal breathing for whatever I'm doing with people.
Yeah.
That if I give someone a very specific strength or a breathing cue, then I'll have them understand why I might be breaking from the idea of nasal breathing. But I try to keep nasal breathing personally with everything until I feel like I really want to hit that last little piece. And I'm also trying to stay there as long as I can until the effort actually takes me out of it. I don't want to come out of nasal breathing because I've psyched myself out to think I need it.
Yeah.
So for a good example would be the kettlebell swing snatch, 100 swings or 100 snatches in 5 minutes, where I used to be very specific with every time I pop my hips, I exhale. Now I don't want to open my mouth until I absolutely need to. Right? And it becomes my way of just staying at my pace. And then it'd be even the same thing with trying to do sprint work on a bike or even sprint work on just on a field. I know I'm not going to hit my max speed, but it helps me to not overwork, right? It helps me keep maybe like an 80%, which is really where I want to be, so that I can do more sessions of that. But it also helps me relax and go with the flow, like go with the efficiency of the movement more, as opposed to trying to get everything from my muscles. And so that's like a personal practice, but I think that most of my clients have no need to really put a max effort out. They need to know how to go faster. They need to know how to feel heavier weight and all of those things. And a lot of times nasal breathing is a way to just get people not to overwork when they don't really need to overwork, or they need to actually kind of get more internal and focus on stuff that is less about effort and more about, technique or, something like that.
Yeah. Oh, that's cool. I've been starting to mix it in more and more. So yeah, I've been finding it valuable, but yeah.
Awesome. Did you read the James Nestor book that just came out and he was on Joe Rogan's podcast?
No, I haven't.
It's a good book because it ties into so many things that you've likely heard or I've certainly heard from different places, but it's a journalist perspective, and he did, all of this research by putting himself into these different breathing worlds, Wim Hof, Kriya Yoga, just, different places. He did a really good job of breaking down the chapters into the attributes that you would look for breathing. Would be like slow it down, breathe less, all of these things. So I thought it was really well done. And then he was on the Joe Rogan podcast, which will make it much more mainstream, which I think is a very good thing. But it tied into stuff that is in PRI, is in, he didn't mention PRI, but it is just, like things that you'll get from PRI are right into what he was saying. So for a very specific example, actually, after I did the cervical revolution course from PRI, it was all about airway. There was a dentist that was sitting right next to me. He had a book called Gasp that, he gave to the people in the audience or the other classmates. And so after I read that, I sought out a airway specialist in the area. Well, now this specialist, Dr. Marianne Evans, she's like in Glen Mills and Newtown Square. She's my children's orthodontist, and just she's pretty well known in the area, but she's pretty cutting edge too. She was mentioned in the book because it was.
Oh, that's so cool.
She's the person locally here that is just doing a lot of stuff with airway tied to the breath, but that was put into the book, which again just ties back to a lot of stuff PRI talked about, which you would never really connect to, like neck health and and autonomic nervous system health and pain down the chain. So it's a good book to look at because it's very current, it's very now, and I think it touches on a lot of other things that you can look deeper into. I'll
definitely check it out. That sounds awesome, actually. So cool.
All right. Yes, this was good. Let me know if you have any further questions, and then we'll meet up next week.
All right. Sounds good. Thank you, Chris.